Hi there, everyone. Welcome to today's Investor Education Series. I am Kat Delgadio here to co-host our event with our CEO, Hal Martin, who's going to give you a little bit more information about what we do here at 10 Capital. Well,
Great. I want to thank everybody for joining us today for another great round of presentations. Before we do that, let's do introductions. First, we'll introduce 10 Capital, and then we'll introduce our panelists. At Heart 10 Capital, we help startups and investors connect for funding. We have several events online, in person, dinner events, and otherwise, and this is one of the virtual events that we run. Next slide. So we help companies put together their fundraise strategy, their deck, their due diligence report, their analyst report, and other key documents. Then we make introductions through our online and in-person events. And then we help with the follow-up. We help all the way through to the close of the round. At Heart, we provide the legwork, saving you time and money. Next slide. We also help form capital for the early stage ecosystem. We help high net worth start family offices. We have a family office program, both in person and online. We also help VC funds find limited partners, mostly through family offices. And then finally, we help angel groups find members. We do this through our dinner event series. And so we're trying to help bring more people and more funding to the early stage ecosystem. Next slide. So we have 4 online events and 1 in-person event each month. We have a family office roundtable. This is for topics related to those starting and running a family office. We have a virtual quick pitch, which is primarily tech companies. And we also have a life science syndicate event, which is for those on the FDA path. And finally, we have this event, which is the investor education series, where we cater to the investor with a content piece. Today, we're going to learn about how to invest in AI as part of the program. And finally, we have 1 in-person event each month. We're adding more to it, but right now there's 1. We just finished with Dallas, and we're on our way out to the Bay Area. Then we'll go to New York, then we'll go to Southern California, and then we'll go to Houston to wrap up this year. If you want to learn more about our events, just go to 10capital.group and look for the events button, and you'll see all the events that we have coming up. Next slide. If you're a startup and you're interested in our program, please take a picture of that QR code with your mobile and fill out the form. We'll follow up to see if this program is a good fit for you and your program and your fundraise. Next slide. At the end, we'll give you a survey. We'd love to have your feedback on how we're doing and look for suggestions on how we can improve and make it better. So please give us your thoughts, and we'll be actually following up on that. Next slide. We also are doing a lot with AI. We've developed over 500 prompts for developing due diligence reports, analyst reports. We have 3 founder suites, 3 suites one for founders, 1 for investors, and 1 for partners that help with decision support through the life of the fundraise or through the life of the investment. These prompts help you understand better how to invest and raise funding. Let's hear more about it. We call it Ava. Here's more about our Ava chatbot.
Hi there. I'd like to introduce myself. My name is Ava, your personal AI venture assistant. I'm your new best friend in the world of investing in startups, the 10 Capital AI chatbot. I'm here to make your journey through the startup ecosystem easier, faster, and a lot more fun. Need help finding your next big investment? Or maybe you're a founder looking for fundraising tips? I've got you covered. I pull all my knowledge from over 500 blogs, countless podcasts, and even some nifty calculators, like the How Fundable Is Your Startup tool, to give you the answers you need. So how do I work? Easy. You simply go to where I live on startupfundingespresso.com and look for me in the bottom right. As soon as I appear, go ahead and click on me to let me know you're here. And then there you go. All your questions answered at your fingertips. Whether you're into health tech, biotech, life sciences, or any of the other exciting fields out there, I'm equipped to help you navigate the trends, challenges, and opportunities in each one. Got a question? Just ask. And guess what? I even pull insights from the 10 Capital Network podcast on Investor Connect. It's packed with expert advice, success stories, and more, all designed to help you succeed in the venture capital world. So what are you waiting for? Let's chat. I'm here 24/7 to help you find the right answers, connect with great opportunities, and make the most out of your investments. See you on startupfundingespresso.com.
Great. And let's meet our panelists for today. First, we have Joe Gildenzoff. Joe, please tell us more about yourself and your work.
Hey, good afternoon. Joe Gilden's off the Gilden Group. We provide fractional executive services, think like interim CEO, fractional COO, or strategic advisory to founder-led startups and SMBs, helping them maximize their transactional value through strategy alignment, operational excellence, and growth acceleration.
Great. Next, we have Keith Newman. Is Keith up on the panel yet? I think Keith may have dropped off. We'll have to go get him back. There he is. Hey, Keith. Thanks for joining us. And can you tell us more about yourself and your work?
Hey there. I have a background in media, marketing, journalism, and have transferred all that into the entrepreneurial world where I've done a few startups. And now, after a couple of exits and experiences to share, I've moved into a go-to-market consulting practice where I help companies develop their messaging, their story, and their growth strategies.
Great, thanks. So the presentations today, we have 4 companies that will pitch. Each will have 10 minutes to pitch and 5 minutes of Q&A. For those on the panel to ask the questions live, and for those in the audience, please put your questions in the chat box or the Q&A box, and I'll read that out. After that, we'll have a presentation, short 10 minutes on how to invest in AI, and then we'll go into the breakout room. So you'll have a chance to go meet with people and talk more about what they're doing. With that, let's go and bring up our first presenter, which is Buddy. Layla, if you'd like to go and launch your slides and kick off when ready.
Hello, everyone. Thanks for having me today. My name is Layla, and I am the co-founder and CEO of Buddy. Now, let's see here. Here we go. What is Buddy? So we are a specialty streaming app. We're built for Gen Z and millennials. We're available currently in 90% of the homes, and we are featuring bingeable, commercial-free, pet-centric content for your family. So it's family-friendly. It's creator-made originals. It's movie series and licensed documentaries, and then health featurettes, which is what anyone who talks about pets will tell you that's what they're looking for. Very important on this slide, we reach profitability with 75,000 subscribers, which if you know the streaming world is a fairly low number. And we are very affordable at $7.99 a month or $79.99 a year. Now, what if I told you that you could blend the $137 billion pet space with the only growing entertainment segment? That's what Buddy is. So Buddy is taking these highly passionate, very involved, pet-centric folks that love to spend money on everything pet and combining them with entertainment space that people are really craving right now. About 66% of households have pets in their homes, according to Forbes. And when you're talking about pet streaming, what people are really looking for is the shows that they want, the shows that they're trying to find, creator-based content. So somebody that they follow that they love is doing something there. They don't want commercials. They want to watch on their calendar, on demand, and they want the ability to binge as much as they can. They want to watch every episode of a show. They don't want to watch it 1 episode a week. It's frustrating for them. You might be asking, are there other people that do this? There are a few people that are doing pet-focused content, but they're doing it differently. Probably the most successful in this space is Dog TV. If you don't have a dog, you may not have heard of this. It is not for people. It is for your dog to watch. So this is what you would put on if you were leaving, going to work. You want to make sure your dog's entertained. It might sound a little bit off to you that that would be a thing, but 400,000 subscribers would disagree with you. They are currently sitting at $9.99 a month with 400,000 subscribers. They do on demand. They don't have commercials. It's obviously original programming. It's very niche. We are a niche streamer, but it's not for people. There's other folks doing this, but they're not doing it commercial free. They're not doing on demand. They don't have originals. They license programming. As a matter of fact, Bark TV is licensing some of Buddy's original programming right now. So that is something that exists out there. You might be asking, what's the TAM? How big of a market is this? Well, you've got 87 million people that own pets. And of those, you have a 61 million overlap of people that have pets and that also stream multiple streamers. Now, if you really want to narrow down, which is what we intend to do with this initial seed round, is find pet parents that are also streaming specific pet influencer content. So these are people that are really in that pet space. These are folks that are consuming that content on social media, in other places, in order to get that content, but it may not be commercial free. It's not going to be a full episode. They're not going to get everything that they want. And so they're really looking for something to fill that. That's 5.5 million folks. How are we going to grow? Well, we've got 3 acquisition channels. We have actually partnered with a company called Media Plus. If you're familiar with niche streamers, you will know a brand called BritBox. BritBox is one of the fastest growing streamers. They went from 0 to 500,000 subscribers in less than 2 years, and the agency that did that for them is Media Plus. We've already built our media plan with them. They've done a significant amount of research in this space, and we are ready to hit go with this investment. We're also going to be looking at influencers and creators and really starting to really leverage that space in a much bigger way for this round of seed funding. And what that brings us is super original hyper programming that will bring viewers to the platform. So if I follow an influencer and he's creating content and we want to license that content and make him a original programming creator, the only place for those folks to get that content would be on Buddy. So they would bring all of their subscribers there. Now, if you think about the way TV in general works right now, lots of programming is reality TV, and a lot of the people that are cast in those programs are influencers with a significant amount of followers. Why? Because that's how they get viewers to their program. So this is a tried and true strategy, and we know that that is going to work for us. And then the third way is bundling partnerships. So when you think about lifestyle subscriptions, there's lots of these that cross over in the pet space. And one I will just mention is the bougie dog park. Every town in America has at least one bougie dog park. Folks are paying over $30 a month to take their dogs to a private dog park that offers different amenities. And so we're partnering with groups like that. Think of like the Bark Box and Cat Lady Box, those types of folks. We're working with them to be ready to do a bundled subscription when we are ready to hit go. The team that's bringing this to you is myself. So I'm the CEO. I am also the co-founder. My husband and I have invested over $1.5 million of our own dollars in this. I bring customer segmentation, data, and branding to the package. I've led 2 IPOs into the public market on the retail space. My husband, Ryan, who's on this call, is our COO. He is bringing strategy, execution, and the thinking that's going to bring everything into fruition as we go. He comes from several very successful media companies that he has exited over the last 10 years, and he's a very strong production eye. And also with us is Nathan Fletcher. I see he just turned his camera on. Nathan is coming to us from several channels across linear cable. So Great American Country, Ride TV, successful exit on Ride TV to a transaction of 150 million. He really, really understands production and programming, and that's what he's bringing to the table. We've done a lot of things in 2024, most of which is getting us ready for this launch. We are currently in 91% of CTV, which was a big hurdle. Getting on Samsung was the longest and hardest. We are currently in all of those. We've identified our creators and we have our Media Plus plan. So we are ready to hit go with funding. What's coming? So we're working on AI for Buddy. Buddy Helps is a section that exists currently in our platform. You can go in and type any kind of health concerns that you have, and it'll serve up content to help you with those pet concerns. We also, in a small way, use AI currently to create more of that content. So if we see people searching a certain thing, we can create content around that. We intend to invest heavily in this in the next 5 years to really create a robust platform. We will also be building a proprietary platform. We will have shoppable episodes on our original programming. So meaning with a QR code, you can scan it, you can go in and shop everything that's in that episode, from food to merchandise to clothing, any of the pet products. And we'll also be licensing Buddy merchandise. So we're focused on growth for the next 5 years, but we do get the question asked a lot of like, okay, what does this mean? What are you guys going to do? What do you see as a potential exit? There's several potential exits here. There's always a possibility of being acquired. There's several of these, but the most notable is Crunchyroll. If you don't know anime, you've probably never even heard of Crunchyroll. But Crunchyroll was acquired in 2020 for $1.2 billion by Sony. These larger media companies are not looking to build their own niche streamers. They're looking to pick up successful small niche streamers to add to their portfolio and bring new viewers to their platforms. And so that would be a possibility. You could see a merger with a similar platform like Dog TV, Bark TV, something like that. You could see an acquisition with a major pet brand, someone like a Chewy or a Purina. They don't want to build this kind of thing. They want to pick up something that already exists and just wrap over it and put all their content in there. And there's always possibility of a management buyout, PE, anything like that. So why are we viable? We're really primed and ready to go. This is a winning idea. Someone is going to do this, and it's going to take them a long time to stand up everything that you need, build the platform, get the content, create the relationships they have. We're there. We have a large TAM of 60 million. And we've actually narrowed that down and been very conservative. We're only assuming attaining 1% of the TAM, and we are incredibly successful with that 1%. We have a tremendous amount of talent combined on this team. And this space is unclaimed and someone will take it. We're currently looking to raise 500,000 in this limited seed through a convertible note. The discount rate is 15%, interest rate is 4 to 6%, and we've got 125,000 interested and committed so far. We're looking to wrap this up. The funds will be spent on 3 key areas: marketing, which we talked about, programming expense, licensing new content, creating new content, and sales. Really, the name of the game is going to be to get out there and get subscribers. When you look at this, the highlight here is at the end of 5 years, you're looking at a 23% EBITDA, an 80+% gross profit margin. And this is going to be an incredibly successful business at the 5-year mark. In closing, I would like to take any questions from you, and we're super excited to be here talking to you guys today, and I welcome any questions.
Great presentation, Layla. Joe, what's your first question?
All right, Layla. I understand that 75,000 subscriber counts is what you need to achieve profitability. So at this point, you haven't launched, so you have 0 users so far, correct?
We have a few users that are more word of mouth. We've done a couple events. We've got friends and family on it. It's not any substantial, but the platform is up and working.
Fantastic. This might be a premature question, but do you have an estimate of your LTV and or the customer churn, what we expect it to be, whether that's based on your experience or based on other similar streaming networks?
We do have that, and I think Ryan might be looking for it right now because I think it's in the appendix. We're basically estimating a industry standard right now. I will say on the churn that we have, it's like 99.5%. It's a very low subscriber base. But I think Ryan,
the customer acquisition cost would be the industry average. What we'll be aiming for is $52.33. And the lifetime value of that customer that we've distilled out to Buddy is it's just under $400. It's $399.
And the churn is less than 2%, I believe.
Correct, for our platform right now. Churn would go up to industry standard churn percentage, which is, Nathan, what is that? Do you know offhand?
It's a big range, depending on the particular platform. Netflix is kind of the gold standard, and they're about 3 or 4%. So we want to be around that range. I think our model projects 5% because we're playing it safe.
Great. Let's go to Keith for his first question.
Yeah, like I mentioned early on, I have a background in journalism as an editor. I used to say on occasion, you buried the lead. And all that means is, I think the highlight of the story, or the one that really I was eager to see, was the actual content. What is it that you have that is super compelling that's going to make me want to jump aboard? Actually, the stuff you did around that was very compelling. I think you've put together a really strong story, pitch, and I feel like you checked almost all of the boxes for me in a short time, and I'm sure we would have got there shortly after. But what I was looking for was some evidence, so example of the content, and then evidence that, quote, the dogs are eating the dog food. Come on, you got to like that analogy. But
I smile.
but I'm sure you have that. I just think as an investor or as a marketing head of journalism media, excuse me, background that I know a little about, man, there's so much content, there's so much noise, there's so little engagement going on. Everyone's starting a blog, a pod, a CTV play. I mean, there's tons out there. How are you going to get through the noise? I got to see it.
Sure. So
Sure.
I can answer this a little bit, and Nathan might want to jump in. So right now we feature mainly licensed content. We're probably about 80% licensed and 20% originals. We did develop original content, Possum Profiles, which is all about dog breeds. We have a talk show slash podcast type format, which was done very well with high production values called uh, Nathan, what's it called? Sorry,
Buddy's
this coming
Besties.
back from vacation is terrible.
Buddy's Besties.
Yes, Buddy's Besties, where we interview pet psychics and we interview dog trainers and we interview, people who rescue dogs and cats and things like that. And so that's something that can go on indefinitely, right? And we've launched with those. We plan to do more. And then once again, that influencer content. So for instance, I always use them because we've had really good talks with them. Bob the Cowboy Cat Wrangler. He goes out every night, Keith, and he has colonies of cats, and he has all sorts of adventures every night. He runs into the police, and he runs into homeless people, and he feeds his cats, and sometimes the raccoons come in, right? He's doing a free program all on his own. He's got about 10,000 followers on Instagram, and he's putting up a free program every day. So we don't need to pay him a lot of money. And trust me, we've had these conversations. And people said, well, how do you know he's going to do it? Because he's doing it right now for free. So it's something that he can bring his followers to, dedicated pet people, onto Buddy to keep watching him.
Great. And that's our 15 minutes. Thanks so much for good questions, guys. Appreciate that. Let's move to our next presenter. We have William Price. Brian, if you could launch your slides and kick off when ready.
Yes. Second. You see it?
It's there now. Go ahead. Well, you need to put it in full screen mode.
Yes, so my name is Brian Cleary. I'm the CEO and co-founder of William Price Distilling. We're a craft distillery in Houston, Texas, and we're looking to craft the future of coffee cocktails. Right here on our screen, I can show you some of our awards. We've got first place in the American Distilling Institute. 3 years out of 3 years, we've had the best coffee liqueur, and we've also won a gold at San Francisco World Spirits. Go next. So our vision is to be the new standard in coffee liqueurs. We want to create a lifestyle brand at the intersection of coffee, craft spirits, and premium coffee. For us, what we're looking at for a market, the coffee is the world's third most drank beverage. I assume everyone on this webinar actually drinks coffee, so I won't make my joke about those to leave the room who don't drink coffee. But we see a lot of growth and 3.5% CAGR in the coffee liqueur segment. That coffee liqueur segment has a TAM of 4.2 billion. So it's a stable segment that continues to grow. It also only has one dominant player, that's Kahlua, with a 55% market share. That 25% market share is very addressable for us and is very fragmented. For the on-premise sales, we do see the espresso martini cocktail as a growing cocktail, 50% year over year, and it's the third most drank and requested cocktail in the bars. What we do see as an opportunity is that coffee liqueur is a legacy brand, Kahlua is a legacy brand in the coffee liqueur market. It's mass marketed, it's outdated, and lacks authenticity. They have such a dominant position that they don't actually stay relevant, and they are very dated on the shelf. That's in compared to the coffee culture that we see evolving, the craft coffee, the daily rituals around coffee. So if I ask you what your daily ritual around coffee is, whether you drink it at home, you stop by Starbucks, it's always part of your day and always makes you feel better. So we're trying to we're developing a lifestyle brand that will hit that emotional connection and be a better connection to you than the Kahlua of yesteryear. So again, focusing on our solution, we have an elevated taste and a quality, locally sourced coffee liqueur from Cat's Coffee that we've won awards with, and hope to develop that upscale lifestyle brand. Our target market is the 25 to 45-year-old millennial Gen Z female. They are upwardly mobile, hopefully, and early adopters, but they seek authenticity. So they look for that taste and emotional connection to their brands. How we intend to use our business model and sales. So again, building that lifestyle brand. We are also focusing direct to consumer and on our Houston market right now. So we have a tasting room here in Houston that creates a good portion of our sales right now, but we also look for that significant market opportunity in the on and off premise, which is the bars and restaurants, as well as the liquor stores. With over 7 million people in Houston, this is a large backyard for us, and we have a good amount of opportunity to continue to grow just in Houston before our strategic expansion to the other Texas metropolitan markets. So our sales channel, again, is the tasting room right now. This is where we do a lot of our frontline trial and testing. So for example, we have some distillery-only releases, such as a holiday coffee liqueur or a barrel-aged coffee liqueur. We also do on-premise, so that is the bars and restaurants. We have good inroads with Haywire, Good Company, and Mastro's. And that provides the brand visibility at the most points, as well as easy access to our products, especially in coffee liqueurs. And then the off-premise is where we make the most volume, and that will be direct to consumers through the liquor stores. Our additional future play is that we are developing a ready-to-serve espresso martini for the grocery store channel. The big point of differentiation here is that we're developing it to be a wine base, which under Texas law will go to grocery store channels. Liquor is not allowed to be sold in grocery store in Texas, so that gives us a lot of opportunity there. It opens up the 9.4 billion RTD market, which is a separate market other than the just liqueur market. And again, that opens up the Texas retail channels and gives us a good position to fight off any other newcomers. That coffee ready to serve market barely exists, and people are looking for a product that's not a ready to drink canned cocktail, but something where they just chill, shake, and serve. So our traction, we actually are in the market and have been selling for the last 4 years. We have 65 to 30 or 83% gross margin on our wholesale and direct to consumer. And our total sales to date is 3.2 million in revenue, with over 110,000 tasting room visitors. Our margins and our unit economics are very depending on where and what product you're buying. So for example, our coffee liqueur versus our ready to serve espresso martini versus our whiskey, our coffee liqueur is the highest grossing margin. And that is due to just lower cost of goods and a better markup for us there versus the whiskey portfolio and other products we have. Those are lower margins. Our unit economics, again, change with the sales channel. So wholesale is the same as bars and restaurants. Again, our cost of goods is $3.75 per bottle, and our revenue wholesale is $10. Well, when we sell it directly through the tasting room, that's $28.99, and we get even better margins when we do espresso martini. However, we do have increased costs. To the use of funds, we're looking to raise $2 million right now, with the use of funds mainly in the brand marketing, tasting, and sales team, with additional funds into the inventory and working capital. And if we oversubscribe, we'll look at restructuring some SBA debt. But we're really focused on growing the brand and building customer resonance within the Houston market. Long term, this should give us about 2 to 3 years of sustained operations and increased marketing to build that customer base, and with expanded distribution across the Texas metro area, as well as provide support and scale for our wine-based direct-to-consumer coffee or espresso martini. The team here is me and my business partner, Zach. Zach is in charge of all the sales, while I focus on the broad strategy. We also have Robert Kasperzak, who is our lead angel investor. He actually has history growing and scaling a multi-billion-dollar diagnostics business, as well as his advisor, Kevin Spivak, who has experience in the Patron and Seagram's joint venture and distribution and growth. We're always looking for additional partners and strategic advisors to help us grow as well. As an exit strategy, we're looking for a 5-year horizon. Our M&A target, we would be an M&A target for all of the following brands: Constellation, Bacardi, Campari, Heaven Hill, and Brown-Forman. We would not be one for Diageo because they do own the Kahlua. We are looking for return on investment from 2.5 to 6 with a revenue multiplier of 5 to 8. So again, our round terms, we're looking for a convertible note with 2 million and oversubscribed up to 3 million. We actually have 1.1 million raised. Our existing angel, Bobby, actually has pledged an additional $1 million to this round and an additional 100,000 from our new investor. We are looking at an 8% interest with a 20% discount and a 5-year maturity. And to that, I would open up to any questions.
Presentation, Brian. Keith, what's your first question?
Well, I thought it was a great presentation also. However, I have been involved in the liquor business and realize it's a big hill to climb to establish yourself as a brand in this category. I didn't hear enough to understand what about this product is really going to make it stand out. For example, I live in the Bay Area. I love coffee, nearly an addict. And I also like the coffee spirit sometimes. And I actually see the coffee martini and a few other things really taking off. But again, I've not seen this brand out there. I haven't touched it. I haven't seen it. I shop at Costco. I shop at a bunch of liquor stores as well. And I just haven't seen the marketing, Brian. So great story. It's a big hill to climb, though. That's my biggest challenge.
Yeah, so to address your specific questions, the liquor market is very regulated. And since we are in Houston, Texas, we're trying to own our backyard first. So we're really focused on the Texas market. We aren't in California yet, but that is a future goal of ours. Again, every state you go into, especially one with the linear distance away from California to Texas, that requires a larger investment in the sales side and the marketing side.
Great. And Joe, what's your first question?
Who's handling your retail distribution in the state of Texas?
So our distributor is Greenlight. They're our sole distributor. We have an exclusive contract with them across Texas for the next few years. After that, they sell into the liquor stores, including Specs. We're in about 70 Specs in the Houston area. We are in 200. My business partner told me 300 now locations for liquor stores, bars, and restaurants. We also have distribution into Total Wine in a couple locations across Texas.
How much have you raised, debt or equity, prior to this round?
So equity, we've raised 1.7 million. We do have an SBA loan that has 600,000 left to be paid down. That was for our launch about 5 years ago.
Great. Keith, what's your second question? Oh, go ahead, Joe. Finish your question.
Ahead.
Okay. Keith, what's your second question?
It really was about the retail distribution and the plan to expand, but also what do you view as like a major marketing expense? How are you going to break through in terms of becoming a brand that's recognizable?
So the marketing expense goes to Liquor to Lips. It's a lot of in-store tastings. That has a higher customer acquisition cost than getting into a bar or restaurant. to get into a bar or restaurant, you just have to get a person in there, talk to the bar manager, get them to try it. Sometimes that's a zero cost, but other than the sales team and commission there. But for a liquor store tasting, it's usually you have to buy the bottles, you have to pay the staff. That usually comes out to about $100, $150 per tasting. But again, that's an easy conversion. I have about a 50% conversion rate when I taste people. So for every 10 people who taste the product, 5 end up purchasing a bottle. So that will pay for itself. If we get 15 people to try it, that will pay for itself. 15 people to buy a bottle, that tasting will pay for itself. The other part is just more marketing, doing email newsletters, influencers, being on social media, paying for our marketing teams, and getting into the market with support such as buying bar rails, buying merchandise that goes into bars and restaurants.
Great. Joe, what's your next question?
What level of revenue do you anticipate you're going to have to reach in order for a strategic to find you interesting?
So a level of revenue, we're probably going to look to be about 10 million before we become interesting. But we do see some people at around the 7 million mark and even lower, but those are more niche markets. We are in a niche market as a coffee liqueur versus a whiskey or a vodka. And we are the coffee liqueur is very, very scalable, but we are looking for about the 10 million at the 5-year mark.
Right, but the business is tasting room, coffee liqueur made with wine, whiskey. It's the entirety of what you're producing, or are you raising money singularly on the coffee liqueur?
We're focusing on the coffee liqueur. The other products are going to be in our tasting room and secondary sales or tertiary sales. But the coffee liqueur is 80% of our distribution sales, so that's what we're focusing on as a big differentiation factor. We don't have to fight with all the vodkas and the whiskeys in the world. We just have to compete against Kahlua.
And Mr. Black.
And Mr. Black, yeah.
Great questions. I think one thing I found interesting about this deal was the fact that he made a wine-based version, which gets him into the grocery store market, and he's alone on the shelf there with a what looks like a liqueur, but is really not. So I think he's got a competitive advantage with that for sure. With that, let's move. Anything you want to say on that, Brian?
No, thank you for your time.
Okay, thanks so much. Let's bring up our next presenter, which is Renerva. Lorenzo, go ahead and launch your slides and kick off when ready.
Yes, thank you for having me, Hal. It's a pleasure being here. Can you see my screen?
Yes, we can.
So my name is Lorenzo Solari. I'm president CEO of Renerva. Renerva's mission is to develop technologies for peripheral nerve injury. So a very different sector than the ones that we've seen so far. We are here to address a 2.2 billion pain point just in the United States, which is painful neuroma. This is a condition that occurs after any nerve injury, that can occur after any nerve injury, but it's specifically after an amputation, where up to 48% of patients develop neuroma. And neuroma cause chronic pain with a severe impact on quality of life and productivity. And in particular, amputations are the #1 cause for the development and painful neuroma for the development of opioid use disorder, which is, of course, has been a terrible epidemic affecting the United States. Our first product is fully developed. Is a nerve capping device. So it's an implantable medical device that the surgeon performing amputation would connect to each transected nerve end, especially the major one involving an amputation. An amputation leads to at least 3 major nerves amputated after each limb amputation. So the device can be used for each of these major amputated nerve. We've shown in multiple studies that have been published, highly rigorous studies that have been published in High Impact Factor Journal. These are peer-reviewed scientific publication from the Nature group, a 17-fold reduction in the growth of the nerve, which is what essentially leads to the formation of neuroma, which is an uncontrolled nerve growth. So if we prevent the nerve growth, we can prevent the neuroma. And we've shown a 17-fold reduction in nerve growth against a standard of care control. In a separate study, we compare the device-treated nerve with a standard of care treated control, and we've shown a 3.5-fold reduction in pain. Now, imagine for a patient affected by chronic pain, the difference between having their baseline chronic pain and 3.5-fold reduction in that pain. That might be a difference between living a hell of a life, which frankly many of these patients live, and living a normal life. The technology is protected by 3 families of patents. The first, which in the United States and internationally, the first which is has just received an issuance or a notice of approval in July. So the first US patent has been issued. We also receive a favorable freedom to operate assessment done in the United States. The technology works in a very simple fashion. The surgeon performing the amputation procedure can connect this cap to the nerve that has been transected with just a couple of sutures, with no procedural deviation, and literally taking less than 2 minutes. This is something that any surgeon can do. The technology has an internal structure that allowed the nerve to grow within, but find a resisting path that essentially prevents the growth. And in particular, this structure is also multiple channels that allow the nerve to grow, but in a compartmentalized fashion. So this unit of growth of the nerve, which are called axons, grow slowly within the device, but they cannot entangle with each other and with themselves, which is another mechanism of formation of neuroma. The technology, the device degrades in 8 weeks, so a couple of months, and leaves essentially with what we've seen in this study, published studies, results that is essentially a complete interruption of the nerve growth in proximity of the nerve stump that is stable over time. So this technology will offer the opportunity to the various stakeholders involved in the utilization of this technology, first and foremost, the end user surgeons that are performing amputation, the ability to provide a predictable outcome for their patient and much better than their standard of care that they're used to. And this is with something that is affordable and certainly super easy to use. For patients, it's very intuitive, the benefit and the value of adopting or having their physician adopt this technology. For providers, which are purchasers of the technology, like hospital system, integrated delivery network, and the like, both in the outpatient and inpatient setting, they would experience a higher profitability by using these technologies, as dedicated reimbursement codes are issued for this technology. And finally, payers, which ultimately pay the bill, would see a lower total cost of care, where in the status quo, they would see an amputation procedure, which costs about $30,000, be followed in about 50% of the cases by follow-up surgical procedure, which costs other tens of thousands of dollars, and which are prone to the recurrence of neuroma. In the alternative reality in which they would adopt this technology in the preventative fashion and use at the time of initial amputation, they could only spend an incremental $1,000 to $2,000 to $3,000 instead of spending later tens of thousands of dollars in follow-up procedures. The market for neuroma can be split into 2 major segments, which are the neuroma prevention and neuroma treatment. We estimate the global market combined is a total target market to be about $6 billion. The technology would position itself in a competitive landscape, which is characterized by multiple solutions, but these solutions are either adopted most of the time, so very broadly distributed, but are not effective. So essentially, they don't work and they're used a lot, or they work like some complex surgical techniques. They're very expensive. They might cost the system $30,000 to perform. They require a ultra-specialized surgical training to do that, which essentially only a few physicians can do. And as a result, less than 3% of US patients receive these procedures. So the technology, the PNM cap, the Renerva's cap, would be positioned as the technology that offers the trifecta of affordability, ease of use, and most importantly, efficacy. And this is certainly a space that is missing in the competitive landscape. The technology would be regulated in the United States as a Class 2 medical device. So this is a lower risk classification for medical device and would be approved or clear on the US market with a path that is called 510(k) or pre-market notification path. We have already started the process of seeking dedicated reimbursement code by pursuing what's called a breakthrough designation, which will allow the company, upon generation of initial clinical data, to have dedicated code, which will literally inflect the adoption. We are a team of dedicated professionals with more than 150 years of cumulative experience in the various functional area. This is my second medical device startup. I was not leading my first one, which sold this IP after developing cardiovascular devices and doing multiple clinical studies in Europe. We have a team also including a board member, Pete DiComo, who's a retired former medical device CEO, which successfully exited to the medical device companies. And we also have additional specialized help in the various functional area. We also have a scientific advisory board and medical advisory board, which literally consists of top key opinion leaders in the space of peripheral nerve injury and repair. This is just a subset of the physician and scientists that we work with. Renerva is at a particular juncture where we are essentially 2 months away from receiving approval from the FDA to conduct our first-in-man clinical study, and we are about less than a year from receiving in the United States approval for market, essentially sales. We are raising a bridge to Series A round, which we'll see in a moment, will allow us to essentially bridge to a Series A that is going to be of $10 million, which will enable the technology to be launched in the United States. We believe the Series A in 10 million, the future Series A to be raised in 2026, to be the last financing that the company will need before reaching an exit upon obtaining small-scale market validation in the United States 2 to 3 years after market launch, which is expected in Q3 or Q4 of 2026. The company has experienced a very high momentum. There's a lot of investor interest at this point. We have published a second peer-reviewed publication in the High Impact Factor Journal from the Nature Group, NPJ Regenerative Medicine, showing all of the tremendous results in our preclinical study that I mentioned earlier. We've received a notice of allowance for the patent. We have also been awaiting, and we expect to receive an approval to test this in humans in less than 2 months. We believe that we will enroll our first patient before the end of this year. And also, we have just received a notice that we are essentially already being awarded almost $1 million in additional non-dilutive capital. So we are raising a bridge to Series A round with a target raise of 1.5 million. We have already more than 280 hard committed, which is expected to close in the next week or two from existing investors. The round has literally officially just opened yesterday and is expected to close on December 31st. We will use this capital to perform this pilot first-in-man clinical study at Ohio State University in 10 patients. We're also expecting to submit this request for market approval and to be clear in the United States for market launch by the end of 2026. The terms are incredibly favorable for these convertible note plus warrants. In summary, this is a large market opportunity for which we have a fully developed, protected product that has high physician pull. We are awaiting FDA approval for a first-in-man study and FDA clearance for market launch next year. We have very favorable terms. The due diligence from the 10 Capital Group is going to be available and access to our data room within a week from now. We hope that you will join our mission. Thank you. I'd be happy to address any question at this time.
Great, Lorenzo, for a great presentation. For those in the audience, please post your questions in the chat box and we'll read them out, or the QA box. Joe, what's your first question?
First of all, great job. Wonderful presentation. Sounds like exciting things are ahead of you. Does the device work only at amputation, or if a patient is suffering a neuroma and the pain associated with that post-amputation, can this be applied after the fact? In a secondary surgery?
Excuse me, to interrupt you. Short answer is both. Our main target market is the segment that is the prevention segment. So the use of the technology when you are performing an amputation procedure to prevent the onset of neuroma. However, the second segment, which is the treatment market, the one that you mentioned, is absolutely another target market, is just much smaller. But absolutely, these would be used by the physicians that are essentially operating the nerve that has developed neuroma to correct that neuroma, and the technology would be used in that context to prevent the reoccurrence of neuroma.
Great. And Keith, what's your first question? Go ahead, Joe. Finish up.
Yeah, one last question. Is the device perishable? I asked because you're saying in the body it takes about 8 weeks to metabolize. I'm assuming that outside of the body that it's also to some degree perishable and probably requires some degree of special handling.
Yeah, well, it's a great point. So the technology, once implanted, it degrades within 2 months, so 8 weeks, 8 to 12 weeks. However, in storage, the technology is packaged and terminally sterilized in a lyophilized fashion, so it's completely dry, and it has a shelf stability between 1 and 2 years. The shelf stability is a notion that needs to be tested. We currently have completed 6 months testing, but based on similar devices in the tissue-based space, we expect a shelf life to exceed at room temperature 2 years.
Great. Thanks, Joe. Keith, what's your first question?
Well, I agree. That was a great presentation. And Lorenzo, thank you for the contributions you're making in medical science. I really think this is an exciting new area I was not aware of. To play on my marketing background and the subject matter, there's a phrase that we use, are you a painkiller or a vitamin? I don't know if you've heard that, but really, I needed to understand that the difference that what you offering into the marketplace, how dramatic of a difference you're offering. And so some comments from doctors, even from your advisory board, in terms of what they were seeing, the value, is it incremental? Is it significant? How significant? How can I start to build a case for this internally? I know how hard it is to get doctors' attentions in mass. I don't know about this specific, medical profession or segment in the medical profession, but I know it's really hard to get doctors, and that's a tall task. But if you have the support of all those advisors and doctors, you have a better chance. So you said you have tremendous pull toward that, and I think I would like to hear that, but I think that's something I would just suggest in going forward.
Yeah, and Kate, I think you have a very valuable insight, and I completely agree with you. If I can try to address your question or critique, which it makes perfect sense, you're completely right. We have the process of technological adoption from in the medical and the implantable space, especially that we intend to pursue in our go-to-market strategy, involves 2 phases. The first one is the key opinion leader step. We intend to pursue in the first year our relationship with existing highly specialized physicians in the space of peripheral nerve and repair. These physicians have been showing a tremendous interest because they have a real keen interest in testing and being early adopters for new technologies. They have shown an interest and really sensitized awareness of the issue related to peripheral nerve injury and repair and what that comes with. Whereas the bulk of our adoption user, which are non-nerve specialized physicians, which are those that actually end up performing the majority of the extremity amputation procedure, those will be targeted after we have created an initial gravitas from those that really are sensitive, they are expert, they are early adopters. Those physicians are not as sensitized, the bulk of the future users, to the issue of peripheral nerve after the amputation, because those are not the physicians patients that the patient go back to after they develop the issue. They go back to the specialist in the nerve. So for us, it's very critical to conquer that smaller group of highly specialized physicians, and that's what we intend to do in the first year. With regard to demonstrating this relationship and this interest, I can do a better job during the presentation. I completely agree, adding testimonial. What I can tell you is that we've already designed multiple clinical studies, not only the 10-patient one that I just mentioned, but also a much larger one that is going to be performed seamlessly with the launch of the product. That's a post-market clinical trial that essentially will be proceed in parallel with the sales. It's not mutually exclusive. And we've already easily recruited 10 sites to perform a study on 200 patients. And these are the sites with the highest key opinion leader, and which are mostly localized in the Midwest and Northeast of the United States, which is the area where we focus our go-to-market strategy. So I agree that I can do a better job at adding those testimonials.
Yeah, that's fine. Just one quick follow-up. How much you think you're going to need to raise to reach the goal you have in terms of revenue, say 3 to 5 years out?
Yeah, we believe that this first, we've been incredibly effective with our non-dilutive raise. We raised on average $700,000 in grants, so free money since 2018. Consistently, on average, we raised 2.3 million in dilutive capital. We're raising a 1.5 million bridge round, and we expect to raise a 10 million Series A. So this would be a $15 million total capitalization, which we believe, dilutive capitalization, which we believe will take us to a potential exit within 2 years from market launch.
Great. And that's our 15 minutes. Thanks so much for great questions, guys. Let's move to our final presenter, Resper AI.
Yes. Can you see the screen?
They're coming up. We see them now. Go and kick off when ready.
Excellent. So thank you for inviting me to present. I'm Nimrod Binoun. I'm the co-founder and CEO of Resper AI. And Resper AI is actually, our vision is to revolutionize the chronic respiratory care by empowering millions of chronic respiratory patients to live healthier, longer, through a passive, real-time, innovative AI-driven monitoring platform. Our first indication is a disease which is called COPD. It's actually, we're talking about 500 million patients suffering from COPD, which is, most of you probably know, it's an abbreviation of a chronic obstructive pulmonary disease. It's actually a progressive lung disease that makes it hard to breathe due to airways inflammation and obstruction, mostly caused by smoking. So we are talking about 500 million patients suffering from it globally. It is the fourth cause of death, with over 3.5 million people dying from the disease every year. And most importantly, it's the fourth cause of hospitalization, with over 700,000 patients hospitalized every year in the US alone, which actually causes to an annual direct cost to the US payers of over $30 billion. It's a huge disease and unfortunately a very deadly one. And you should imagine one of your relatives living with COPD, lifelong smokers, and we are talking about 20% of smokers and ex-smokers that will suffer from the disease. They're afraid to leave their house. They're worried about the next flare-up, and this is the main problem. 1/3 of these patients will suffer from ongoing exacerbations, ongoing flare-ups, which will cause to hospitalizations, and they're afraid. These people are staying at home and afraid, don't know when they will face another exacerbation, and don't know when they will have to be hospitalized. And what if we will be able to change their story? And what if we can create a world that COPD patients can live independently, free from fear of sudden hospitalizations? And this is exactly what we're doing. Resper AI is developing an innovative home monitoring AI platform that enables chronic COPD patients and their care team to first improve the management of COPD at home, passively predict and prevent exacerbations, which actually can lead to reduction of hospitalizations and provide cost-saving benefits, and the most important thing, to save these patients' lives. Our system, our platform, is divided into 3 main parts. We are developing the heart and the brain, the AI-based algorithm, which actually use physiological parameters that have been collected by off-the-shelf sensors like patches, smartphones, in the future smart rings. All we need is to collect very basic physiological parameters like ECG and movement, and our algorithm, patented algorithm, know how to synchronize between the different parameters and to predict and prevent exacerbations. In our early studies, we can show that we can predict exacerbations even 2 weeks before hospitalizations, which allow the clinical team, to care team, to step in earlier, provide to these patients at home life-saving treatment, and keep the patients at home and save their lives. This information is being directed to the mobile application, dashboard application, sitting at the patient's hand, family members, caregivers, and actually we provide the alerts on time and in advance. Till today, we performed 2 clinical studies. In the first one, we showed that we can successfully differentiate between healthy and COPD patients with a very high sensitivity and specificity, and can present clear discrimination between the different stages of the disease. On the second one, been performed in 5 clinical sites. We recruited, still recruiting actually, over 80 COPD patients. And our algorithm can predict exacerbation 2 weeks before hospital admission. This is the interim results, and now we're expanding the analysis that will to more patients and more exacerbations. Currently, we are working on actually 2 product lines. The first one is an application for monitoring COPD patients at home. This application is in collaboration with a big home care company, US home care company called Right at Home. As I just presented, we have a very promising early study results, and we are getting ready into our first pilot and regulatory trial in the US in collaboration with Right at Home. They are collaborating with us as part of the development phase, R&D and clinical phase, and later on as part of the commercial part. Our second application is application for managing COPD patients' rehabilitation process. Actually, in collaboration with Mayo Clinic, we already started our pilot study in Rochester. We will expand it to other Mayo sites soon. And the whole idea of this product line is to reduce the readmission percentage of readmission of patients, COPD patients, after during a rehabilitation period following valve procedures. These 2 applications is actually the idea is that they will deliver their results into dashboards for real-time chronic respiratory disease monitoring. And this is actually our first product. We are going to launch middle next year, what we call the first generation dashboard platform, which going to sit at the patients' computers and their family members, and will present them the actual status of their disease, including recommendation, treatment options, etc. And later on, after finalizing the pilot studies of our 2 ongoing programs, we will add also the alerts feature into it, and will provide both the patient, the family member, and the caregiver also alerts before the next exacerbations. We have a scalable business model for our solutions. So first, we're talking about the B2B2C model. We are partnering with key strategic partners, and we mentioned 2 of them, the Right at Home, the home care company, and the clinical sites. When the end customer is the COPD patient himself. There are some existing reimbursement codes. We are talking about remote patients monitoring codes, which provide over $1,000 per year per patient only for monitoring their condition. And based on our analysis, we can use these type of codes and can leverage and can prescribe our solution and get these funds. And also, we are talking about a per member per month model with a revenue sharing structure with our strategic partners. So just a short summary, we are talking about in the COPD, the biggest indication, the worst disease in its field. We're talking about an undetected disease that can only identify when crises happen. We're talking about very costly hospitalizations, money and life of these patients, and lack of patients adhesive. And our solution bring a passive wearable monitoring platform which can predict the alerts in advance and can allow early intervention to these patients with a scalable reimbursement model. COPD is only our first indication. And we're talking about a much larger platform, starting from COPD, and then we're talking about asthma and other respiratory indication, and later on wellness and other indications. There are also some initial discussion with potential collaboration with pharma companies, non-regulated wellness applications, and more. From commercialization point of view, we are planning to launch our first platform middle next year, with a very basic, let's say, revenue stream. But once we will launch our two main applications, we can see that there is a high potential sales, which will reach to almost 90 million in 2030, with several value creation events. And we're talking about the first generation launch, then the finalizing of the pilot study for two leading products, and then commercialization launch of our first COPD product in the US market. Our management and scientific advisory board have tens of years of experience in global markets. We are supported by global PIs, including the PIs in Mayo, the US sites. We have an R&D site currently in Israel that can support us with non-dilutive funds and best of experts in AI and machine learning. Up to date, we raised almost $4.5 million, 2.6 as a pre-seed and seed round, equity round, 1.8 million non-dilutive funding, including a Bird Foundation in collaboration with Right at Home. Our main investor in our previous round, we're talking about Invest Nebraska, the lead investor, eHealth Ventures, which is a group of investors like Amgen and Cleveland Clinic and others. Bright Minds, Fund Placement Israel, and private angels. We are looking for our Series A, targeting timing is Q4 this year. We are targeting, the funding goal is $5 million with a soft commitment of almost half of it in a pre-money valuation of 12 million. Let's say in general, 40% of this funding will go to R&D, another 40 to clinical and regulatory, and then the last 20 for marketing and business development. This is it. I'll be happy to answer any question.
Great presentation, Nimrod. Keith, what's your first question?
Well, again, Nimrod, that was fantastic presentation, answered a lot of questions. The one area that I was looking for more detail is an area I focus on, so maybe it's just me, but I felt the go-to-market area. I was looking to understand more of how you were going to bring customers on. What was your main step there? But sounds exciting. When do you plan to first bring this product to market?
So our first product to market, our first dashboard is going to be middle 2026. And then after finalizing our regulatory trial, we're going to add into it the alerts application. And to your first question about the targeting the patient, and this is the main reason we decided to partner with Right at Home. Right at Home has hundreds of thousands of patients, thousands of COPD patients, which are ideal customers for us. We are collaborating with them. They are going to be our face in the market. They are going to market the product to their customer and to new COPD patients.
I got you.
And we're looking for additional home care companies like Right at Home and that can expand our product globally.
How long till I see the product on my watch or my wearable device?
It's actually it's you today you can see that your smartwatch actually has a different. If you're wearing, for example, Apple Watch, you have the ECG sensor, you have the movement sensor. But these companies, they got the FDA approval for their sensor, but they don't have any application for it. So these companies are looking for companies like ours that will that to collaborate with and will provide added value to their customers. So today, for example, we are evaluating a collaboration with one of our smartwatches that are looking for such a solution. We believe that once we will be in the market, let's say beginning of 2027, we will be in the market first with today we are working with a chest patch that know how to measure these parameters 24/7, seamless, very small one, very comfortable one, but still a chest patch. And then a few months after, we'll be able to expand our solution into the smartwatches with a target to be sensor agnostic. We are not developing our sensor, we're developing only the application, only the algorithm, and we'll be able at the end to collaborate with most of the FDA approved sensor, which is today, most of the smartwatches already has it, and chest patches, and in the future also smart rings.
So let's go to our next group. Joe, what's your first question?
I concur. Great presentation. So you're not in the patch manufacturing business, which is great. I appreciate that that you're patch agnostic. But the patch, when applied, as I understand it, monitors and does not administer aid, right? So it's alerting that there is a problem. My question is, from a quality of life perspective, I'm using this device and it's alerted me. It's alerting me what? 30 seconds before the attack, 2 weeks before the attack? And how do I benefit from being alerted?
Excellent question, because in our early stage, in our trial, we identify alerts even 2 weeks before. We are talking about between 5 days to 14 days alerts before exacerbation, before hospitalizations. We perform a retrospective analysis. So we know exactly when the patient was hospitalized, and we provide the alerts 2 weeks before, which provide enough time for the clinician to first, and most importantly, to keep these patients at home. We're talking about post-COVID situation where chronic respiratory patients need to stay at home. They don't need to get into their clinic or to being hospitalized. And they can treat it by very simple drugs like antibiotics, steroids, which expand their airways and can keep them at home and prevent the blockage of the airways and prevent hospitalization. And even 5 days before, it's enough time for the clinician to give a call to the patients, prescribe an antibiotic, tell them you need to take it, and you will be safe and you will be able to stay at home, and we can save you the costly hospitalization.
Very good.
Great. Well, that concludes our presentations today. Thanks, Nimrod, for a great presentation. I want to thank all of our presenters for doing well, and thank our panelists for sitting on the panel today and asking great questions. We have a short presentation on how to invest in AI, and then we're going to open up breakout rooms. We invite those in the audience and on the panel to join them in the breakout rooms. So let me go ahead and share my screen and show you a little bit about what we found is key for investing in the AI space out here. Let me see if I can get over to this and share this with you guys. And we'll just take a few moments to go through this and see what we can learn about working with AI. So if we do, this is not the right window. Let me go get the other one. Let's see, all present full screen. So everybody knows that AI is one of the hottest topics out there right now. It is the thing that is driving everything. For those who are not familiar with AI, it's not only the machine's ability to perform tasks that, are human-like, but it's also putting on, learning, reasoning, and doing problem solving. I find AI is a great idea generator. You learn a lot of different things and it coordinates a lot of different tasks. In addition to AI, there's also machine learning, which is using data to detect patterns and improve over time. And typically these are used together in solutions. So if you're looking to invest in an AI startup, the first thing you want to do is look at the user base and the spending on AI solutions in a particular market. Different markets are moving at different rates into AI and adopting it at different rates. There are those on the front edge, those in the middle, and those that are laggards. You want to know what is the market rate like for the application you're looking for from a particular startup. Also, you want to determine if AI significantly boosts revenue. You often hear people say, well, AI cuts my costs. That's nice, but did that cut cost turn into additional revenue for the company providing the solution? Sometimes the user doesn't actually pass that on to the AI provider. They keep that to themselves. Next, you want to look for the moat. What will protect the company from competition? And what I find is the key thing there is proprietary training data. If you have data that other people don't have, you're in a good spot. If you're just scraping data off the web like anyone else can, you be prepared for a lot of competition. So you're always looking for proprietary training data that you can use that differentiates you from the rest of the world. And finally, you want to look at the go-to-market strategy for the startup. Are they able to get out into the market very quickly? Do they have an established base? Do they have access to channels that will help them grow quickly? Because things move very fast in the AI space. If you're not moving fast, someone else will. So those are things to check out first. So there are key applications in AI, and we see many of them and more every day. In business, they're automating processes and workflows. They're doing data analysis. Healthcare, they're diagnosing disease and doing treatment planning. Finance, there's many different applications around analysis, fraud detection, and treatment and predictive analytics. And finally, there's also self-driving technologies and route optimization. AI is used in all these different things. So you'll find it is just about everywhere. And if it's not everywhere, it will be everywhere very soon. So you're looking for elements of AI that you think are going to actually produce outsized returns for the investors. And so you're looking at the different layers of value creation in the AI space. There's applications which are on the top level. These are end products and applications that you see many startups come out with. Often they lack a strong moat because they don't have proprietary data. They're simply, in some cases, are just a wrapper around the traditional AI tools, and so it's easily copied or is taken over by the tool itself. The one that's more interesting is infrastructure. If you can develop tools at the infrastructure layer, you'll find it can be more difficult to build, but it will last much longer and be much more lucrative. Next, there's models. There's different AI capabilities that you can put into these models. And what we were looking for are models that are often more vertically oriented or narrow. The more general ones are going to be taken over by the bigger platforms, but the vertical specific ones are often niches that are left open for startups. And finally, you're looking for compute, the hardware that actually runs these models, anything that you can do to improve efficiency, speed up the result will gain a large amount of revenue traction from the audience. If you look out there, what you'll find is that some of the key areas that point to a good startup is they're specialized AI over general AI. As we just said, you want to get something that's more vertically oriented or specialized, so it has less competition. Second, I find regulated industries like healthcare, FDA, and those type of things are great places for AI to come in because the rules are set, but they're very complicated and they're very convoluted, and AI can actually cut through that and make that simple. Also, you look for things where you can integrate AI agents into it. So you're looking for things that can perform tasks and integrate with existing systems like electronic medical records and the like. And finally, you're looking for something that has a demonstrated ROI. We see many companies that are starting an AI company, but they've never actually sold or actually completed a solution yet. So you're looking for some element of traction and results that can come from it. So some of the sectors we see coming up fast are cybersecurity, education, and developer tools. See a lot going on in that space as well. So you can see it. Also in the infrastructure, you'll see a lot of picks and shovels plays where they're building the tools that let you run your AI system. Those are very good places to invest as well. So if you are investing in the AI infrastructure, what you want to do is look for applications where you're actually enhancing the existing platforms that are out there. They're taking the current chips and you're increasing their productivity and you're reducing their latency, and you're doing things that maybe redesign the architecture to increase the output from it. Next is if you're going into invest in AI compute, what you'll find is that there are cycles in these systems where they're at times expensive and other times cheap. If you can buy in when they're cheap, you'll find that that's a great place to get started. We saw that with similar tools in Bitcoin. The only way you made money is if you bought low when the market was down and then sold high when the market was up. The rest of the system stayed the same. Also, you'll also find that if you can choose assets that can be repurposed if needed. You find a lot of these chips are now being used for different things and they're outdated. And if you can take older chips and reapply them into some other application later, maybe a more traditional industry that doesn't need as much horsepower, you'll find that you'll have a longer life cycle with it as well. So if you want to use AI for your startup investing, what you might want to think about is a great way to increase your efficiency. You're able to automate deal sourcing, speed up market research, do data analysis on startups that come in. 63% of all startup investors no longer look at your pitch deck. They now drop it into AI and they ask it questions. So if you're raising funding, you may want to make sure your pitch deck is AI friendly. For example, it cannot read anything on a graphical chart or an image or whatever. It cannot read that. You have to type that out on the screen itself. If you're going to if you want to automate your investment thesis, you'll find AI is a great way to do that. It can analyze a set of decks and tell you which ones fit your thesis and which ones do not. So there's great things that come out of it. And then finally, there's real-time tracking of tools where you're monitoring the web to see whatever happens to your list of companies that you're tracking and what is succeeding and what is not, and you can use that and bake that back into your investment thesis. So you'll find that AI is a great place for this to do it. So we actually do this ourselves. We help with deal flow automation. We have AI tools. I have over 500 prompts, and we actually put that out there for those in our program, both investors and startups. If they come into our network and are part of what we're doing here, they get to use those tools for free. Glad to tell you more about that in our breakout rooms here in a moment. But we find it's a great way to analyze pitch decks, websites, LinkedIn profiles, the actual pitch itself, and try to make that a better pitch. It comes out with very good actionable information. And finally, it comes out with great deal terms and negotiations. It can go through and actually analyze cap tables, analyze valuations based on comparables and so forth. So a lot of great things it speeds up in the startup space for those who are using it. If you are diligencing an AI startup, the thing you want to look at first is source and uniqueness of data. What data do they have, or what data are they generating that it gives it a differentiation? Second, is there data readiness? Is there data available to actually run their AI system? We see a number of systems come out where one day it'll be great, but right now there's no data for it. Next is processing costs. Some of these AI systems are very expensive to use based on the number of tokens, the amount of compute processing they're using. You want to know what their cost of compute is for sure. And then you also get into machine learning. Are we using a proprietary model or an open source model? That changes the business dynamics quite a bit and your competitive positioning. And finally, what is their core competency in AI? First of all, they need to have one. And second, is it in the data? Is it in the machine language? Is it in the UL, or is it in the workflow that it's actually putting together? And finally, you look at the team skills to see, do they actually have that, or are they contracting out, or how deep is that pool as well? So those are the key things we look at for diligencing AI systems. We are at the end of our time. I want to thank everybody for coming today. We're going to open up breakout rooms now. I'd love to have everybody in the audience join us, as well as the panelists. And I'll be in a room if you have questions about 10 Capital or about how to invest in AI. Please see me there, and please join and talk to the other people that we have. With that, we'll be back next month for another great presentation in our investor education session. With that, we'll go ahead and wrap up for now and move into breakout rooms. Thank you guys for joining us today, and we'll see you inside.